Welcome to one of the very first and most personal decisions you will make as a new parent: how to feed your precious baby. This topic is filled with a lot of opinions, a lot of information, and sometimes a lot of pressure. It's important to remember that the journey into parenthood is unique for every single family. What works wonderfully for one mother and baby might not be the best fit for another. The goal is always the same, no matter which path you choose. We all want to provide our babies with the best possible nutrition to help them grow strong, healthy, and happy. This decision is deeply personal, and there is no single right answer that applies to everyone. Many factors come into play when deciding between breast milk and formula. A mother's health, both physical and mental, is a major consideration. The baby's specific health needs can also guide this choice. For instance, some infants may have allergies or digestive issues that require a special diet. Lifestyle factors, such as a mother's work schedule, the level of support she has from a partner or family, and even the number of other children she is caring for, all play a significant role. It is a complex decision with many moving parts, and it is perfectly okay to take your time to figure out what is sustainable for you and your family. It is my mission to provide you with clear, simple, and supportive information. My goal is to empower you to feel confident in whatever choice you make. We will explore the benefits of both breast milk and infant formula, looking at them not as competitors, but as two valid and effective options for nourishing your child. Feeding your baby is an act of love, and that love is present whether it comes from the breast or from a bottle. It is about the connection, the comfort, and the care you provide during those quiet feeding moments, which are so precious in the early days of your baby's life. Remember, the conversation around feeding should be one of support, not judgment. Every mother is doing her absolute best with the circumstances she has. Let's move forward with an open mind and a compassionate heart. We will break down the science, discuss the practical realities, and ultimately, help you feel good about the plan you create for your family. The most important ingredient in any feeding journey is a loving parent, and you are already equipped with that. Let's delve into the details so you can make an informed decision that brings you peace of mind. Breast milk is often called liquid gold, and for good reason. It is a remarkable, dynamic substance that your body produces specifically for your baby. It is more than just food. It is a living fluid filled with everything a newborn needs to thrive in the first few months of life. Breast milk contains the perfect mix of proteins, fats, carbohydrates, and vitamins, all in a form that is very easy for a baby's immature digestive system to handle. This natural composition is one of the main reasons it is recommended by pediatricians and health organizations around the world as the ideal source of nutrition for infants. One of the most incredible things about breast milk is its ability to change. Its composition adapts to meet your baby's evolving needs. The milk you produce for a newborn is different from the milk you produce for a 6-month-old. Even within a single feeding, the milk changes from thinner, thirst-quenching milk at the beginning to richer, fattier milk at the end. Beyond basic nutrition, breast milk is packed with antibodies and immune-boosting cells from the mother. These components help protect your baby from infections, like ear infections, respiratory illnesses, and stomach bugs, which is a powerful benefit during their vulnerable early months. The benefits of breastfeeding extend to mothers as well. The act of breastfeeding releases hormones like oxytocin, which helps the uterus contract back to its pre-pregnancy size more quickly. It also promotes a strong emotional bond between mother and child. For many women, those quiet moments of nursing create a unique and powerful connection. From a health perspective, studies have shown that breastfeeding can lower a mother's risk of developing certain health conditions later in life, including breast cancer, ovarian cancer, and type 2 diabetes. It is a process that benefits both members of the nursing pair. However, it is also important to acknowledge that breastfeeding is not always easy. It is a learned skill for both mother and baby. It can come with challenges like painful latching, low milk supply, or clogged ducts. It requires a significant time commitment and can be physically and emotionally demanding, especially in the beginning. Some mothers may find it difficult to produce enough milk, or they may have medical conditions that make breastfeeding unsafe or impossible. Acknowledging these potential hurdles is crucial for having a realistic and honest conversation about this feeding option. Infant formula is a safe, healthy, and reliable alternative to breast milk. It was developed by scientists to be a nutritionally complete food for babies. Modern formulas are the result of decades of research, designed to mimic the nutritional composition of breast milk as closely as possible. They contain a carefully balanced blend of proteins, fats, carbohydrates, vitamins, and minerals that are essential for a baby's growth and development. For parents who cannot or choose not to breastfeed, formula is a wonderful option that ensures their baby receives all the necessary nutrients to grow up strong and healthy. One of the primary benefits of formula feeding is convenience and flexibility. Anyone can feed the baby, a partner, a grandparent, or a caregiver, which allows the mother to get much-needed rest or return to work. This shared responsibility can be incredibly helpful for a family's overall well-being. It also allows the mother to know exactly how much her baby is eating at each feeding, which can be reassuring, especially if there are concerns about weight gain. For mothers who struggle with milk supply or painful breastfeeding, formula can relieve a great deal of stress and anxiety, allowing them to focus on enjoying their new baby. There are many valid reasons why a family might choose formula. A mother may be on a medication that is not safe to pass to her baby through breast milk. Some women have had breast surgery or have medical conditions that prevent them from producing a full milk supply. In other cases, a baby might be adopted, or the family may have a surrogate. For some mothers, the mental and emotional toll of breastfeeding is simply too high, and choosing formula is a way to protect their own mental health, which is vital for being a good parent. These are all perfectly legitimate reasons to choose formula. Today's infant formulas are safer and more advanced than ever before. They are regulated by the Food and Drug Administration to ensure they meet strict nutritional and safety standards. There are many different types available to suit a baby's specific needs. Most standard formulas are made from cow's milk protein that has been treated to make it easier for babies to digest. There are also soy-based formulas for babies with a sensitivity to cow's milk, and specialized hypoallergenic formulas for infants with significant allergies or protein intolerances. These options ensure that nearly every baby can find a formula that works for them. The decision of how to feed your baby is not about which option is better in a vacuum. It is about which option is better for you, your baby, and your family's unique situation. A healthy and happy baby needs a healthy and happy parent. If breastfeeding is causing you immense stress, pain, or anxiety, switching to formula might be the healthiest choice for both of you. On the other hand, if you are able and willing to breastfeed and it brings you joy and fulfillment, that is a wonderful path to take. Both choices can lead to a thriving, well-fed, and deeply loved child. It is also important to know that this decision does not have to be all or nothing. Many families find success with combination feeding, which involves using both breast milk and formula. This approach can offer the best of both worlds. A mother might breastfeed during the day and have her partner give a bottle of formula at night so she can get a longer stretch of sleep. Or she might breastfeed exclusively while on maternity leave and then supplement with formula when she returns to work. This flexibility can make breastfeeding more sustainable for a longer period and reduce pressure on the mother. Ultimately, you are the expert on your own body and your own baby. I encourage you to gather information from trusted sources, such as your pediatrician or a lactation consultant. Talk openly with your partner and family about what feels manageable for you. Trust your instincts. Do not let pressure from social media, family, or friends make you feel guilty about your choice. The bond you build with your baby is forged through countless moments of love, comfort, and care, not by the method you use to deliver their nutrition. Feeding time is bonding time, no matter how it happens. My final message to all new parents is one of encouragement and solidarity. Be proud of the thoughtful decision you are making for your family. Support your fellow parents, regardless of how they choose to feed their babies. Motherhood is a challenging journey, and we all need grace and understanding. Whether you choose breast milk, formula, or a combination of both, know that you are providing your baby with the nourishment they need to grow. You are doing a great job. Focus on that love, that connection, and enjoy every precious moment with your new little one.